A lot of other countries have kind of blown off the CDC's revised. If you saw it last week, CDC changed the quarantine time period from 10 days to 5 days. The reasoning was very convoluted. It was like, well, in most people, 80 to 90% of the infection is gone. So like, don't worry about that 10%. And yeah, you don't need to test to get out of it. It was clearly in response to Delta's CEO pressuring and big business pressuring to get workers back. Fauci, who I'm not a big fan of Fauci, but putting that aside, Fauci kind of previewed yesterday that they were going to possibly revise it again. But Taiwan and other countries were just like, yeah, no, that's wrong. We're not following that.
Yeah, this is actually a really good example of, let's say the government makes the wrong decision, makes a bad decision that can harm people's health. There is going to be an uproar among scientists and criticism from scientists, not a couple of crackpots, a lot of scientists, more mainstream scientists. We don't see that happening with the vaccine. We did see it happen with this reckless decision that didn't really come from CDC. I'm pretty sure it came from the White House COVID task force, which is run by Jeff Zients, who is not a public health expert. He is an incredibly rich finance and management consultant guy. And yeah, that was nakedly, they were even telling us that it was about having businesses stay open while all their workers many of their workers got infected. There was a really, really good kind of clapback from the UK equivalent of CDC, where they put on their own blog, official government blog, people have been asking us to cut down the isolation time to 5 days like the US did. Well, we modeled it and we found as many as 30% of workers might still be infectious if they came back after 5 days. So we're not going to do that. Meanwhile, CDC couldn't produce any science to justify the decision. And yeah, I think we are going to imminently see some level of a reversal. Maybe they'll at least require a negative antigen test before going back.
Can we just be real for a second? Yes, they did it because of big business pressure. But the reason that they probably didn't have the test out as part of it is because nobody could get a goddamn test. It's the same thing as in the beginning of this pandemic when Fauci and others were like, no, you don't need a mask. And then they came out after and said, well, we kind of said that because we didn't have enough masks. So we didn't want people going out and buying masks in bulk. So where hospital workers and medical professionals wouldn't have enough masks. So it's like, common sense would indicate the reason you've said you don't need a test to come out of it is because we don't have enough tests, which a Vanity Fair story came out recently. The Biden administration was offered in October of year a way to rapidly increase antigen rapid tests at home, and they turned it down.
Yeah, that's exactly right. That I do think that played a big role in the decision not to require tests. And since Biden got into office, he has really dropped the ball on many of these things. We don't have the rapid tests we need. We don't have the higher quality masks even being recommended to us. CDC still, their default recommendation is a cloth mask, which is much less effective, let alone making them available to people. They really didn't try, beyond vaccination and beyond giving people extra unemployment and just the stimulus money, which all dried up in September. They didn't really do much in terms of a public health response. They kind of just wanted this all to go away so we can get back to roaring of capitalism. And now we're in this situation.
And let me ask you, like, as we wind down, because I think there's a lot of people who, in my view, wrongly believe that people like you or people like me want this thing to go on forever. And like, for some reason, we're addicted to panicking people and this, that, and the other thing. A, I assume that's not the case. You don't want this to go on forever. But B, for people that are watching this now and are of the belief, enough, this is just a cold at this point, we need to move on. Can you point to specific things that we need to slow down the spread? Specific reasons, maybe not having nothing to do with how many people are dying, but specific reasons why if we let this go unabated and we just say to hell with it, everyone's going to get it, which we've already discussed is not necessarily the case. What are the specific reasons why we should not just allow everybody to get it and reopen the concerts, pack restaurants, pack bars, all that stuff? What are the specific things people need to reconsider?
Yeah, so personally, I definitely don't want this to go on forever. I live alone, and it's not really that much fun. You know, I'm watching Omicron and hoping transmission levels go way down, so I'm more comfortable going indoors in public places with other people. Yeah, it's not been great. I was happy that transmission went down for a bit over last summer. It's kind of like sometimes there's weather and you have to avoid it, and sometimes the weather's better. And if, you know, hopefully this goes down to really low levels that we can just ignore. But that time is not now. So yeah, for someone who doesn't care at all about COVID and getting sick from COVID themselves, one, if you get in a car accident or have any kind of health problem right now in any part of the US, you don't want to be going to a hospital where you're waiting for hours and hours, where there's not enough staff, where the staff is going to be exhausted. You're not going to get very good medical care right now. And then we have this real risk of essential sectors in our society not running at full capacity. You can think about water treatment plants, supermarkets, the people who transport and grow your food. These are the kinds of things that create product shortages, real economic issues, make it hard for you to get services you need. There were even points in the pandemic when so many people needed to be ventilated and on oxygen that they had to divert. I think this happened in Florida. They had to divert oxygen that was being used to purify water in the public water supply to use it for hospitals. So people were advised to boil their water for a while. So yeah, this thing, even if you don't care about COVID, COVID's going to affect your life. Even if you don't get sick from COVID, it's going to affect your life if we allow it to just run wild.
Right. And my last question. So this hasn't really been discussed much, but I also think we don't really know how prevalent Delta still is in the United States. So Delta, kind of like other strands, hit different parts of the country at different times. So right now, Omicron, for example, is very prevalent in the Northeast, New York, New Jersey, Connecticut, and so on and so on. It is all over the country, but some parts don't have it as huge. They're still having remnants of Delta. So can you kind of talk about, is it possible that, hopefully we don't have any future strands or anything like that, but how much of what's going on right now is Delta versus Omicron? And is it possible that if in the fall or later in the year, other strands come, that we could still have Omicron in other parts of the country?
Yeah, in the US in particular, compared to some other countries, we don't have a very good system of gene sequencing for COVID. So some other countries are able to keep really good tabs on which variants are spreading when and where. What we have in the US is just some commercial laboratories participate in these surveillance networks, and they're not particularly good. So there was a revised estimate by CDC. A few weeks ago, they had said virtually all COVID in circulation was Omicron. Then they said, wait a second, we did some reanalysis. It's a bit less. It's maybe a little over half. So I think the hallmark of Omicron is the case. If you look at how the cases move over time, basically like goes up as a straight line. That's how you know it's Omicron without even needing to look at the genetic sequencing. And we're not, yeah, you're right. We're not there in a lot of the country. I do think, we're seeing in country after country, Omicron fully takes over Delta, and then you no longer have Delta. That we are on track for that to happen. Will there be another variant that competes with this months or years from now? We have no way of knowing. It's possible, and like I think we talked about before, we don't know how severe that would be. It could be the same, worse, or better.